17 years old, and I get lost, often. Whether it's in a mall, or a supermarket, or a school, or even on the way here. But I'm not the only one, right? We all get lost from time to time. It's common, so why should anyone care? This is where my story begins. This here is my dad. Somewhere. or not. So can I quickly see by a show of hands who has a dad? Or did have a dad? Awesome. So you can all relate. My dad went into hospital to have some surgery. And when we went to pick him up, I got a little bit lost. You know what that's like, right? You walk down the corridors, and the wards, reception desks, and waiting areas kind of all look the same. Hospital is already a stressful enough place without the unwelcome bonus of being lost. But this doesn't answer the question of why you should care. Well, on the way to find Dad, I stopped 3 people to ask for directions. These were busy people on their way to do other things. This is a big hidden cost that simply shouldn't exist. Anyway, we found Dad, and so there was a happy ending there. It wasn't until about a week later when I was playing with my dad's wristband that an idea popped into my 11-year-old brain. Why couldn't we use this useless bit of plastic for more? For years I dabbled in this space, but I was kind of waiting for someone else to come up with my solution. And in late 2014, I realized that I had a unique advantage over anyone else: my age. Because of my age, I was asking questions that no one else was asking. And when talking to medical professionals, I would shut my mouth, open my ears, and actually learn about their everyday experiences. I got out of the building and I went around New Zealand talking to a range of medical staff. This was an eye-opening experience, and it showed me 2 things. Firstly, getting lost is a real problem. But secondly, there were so many more problems I could solve by simply changing the wristband. Being only 15 years old, I had very little money and not much skill. But I did have one thing: passion. And so in early 2015, I launched a crowdfunding campaign to raise money to solve this problem. I raised $6,000. And although that may not sound like much, I got something that money simply can't buy: our hardware guy, Stephen, and he genuinely wanted to help. He had amazing hardware skills, and so we spent half of the money building these. This is the beginning of the solution to all of these problems, and I call it well bands. That is a high-tech hospital wristband with a Bluetooth low-energy chip inside. And that big thing, that's what we like to call a sniffer. They pair together and link with software to provide real-time location-based data. This data is then all packaged up and sent to a smartphone app, which friends and family use to find their way around a hospital. This app would have helped find Dad. Implemented correctly, we can unlock a data mine. This is a massive amount of rich, relational, real-time data that we haven't had access to before. And it gives us insight into how long a patient waits, how staff interact with patients, but what patients are actually paying for. And the possibilities don't stop there. Using the same technology, patients can use the wristband for secure keyless entry to bedside cabinets, as well as to use at vending machines or hospital cafes. The wristband will also be better designed. Now, I can see by looking around that there are a lot of insurers in the room, and this is unfamiliar territory to me, as I come from New Zealand, and all of our healthcare needs are paid for by the government. And I'm going to share a bit of a secret with you. Although I dress very sharply, I'm not an insurer. So this means I don't know how you think or what drives your investment choices. And although I could do what any good startup does and just make things up, I'd like to opt for another way and have a discussion with you about how insurers can really benefit from the system. But why me? What makes me so special? Well, let's run through my 2016 year so far. I spent 3 months working with the New Zealand government in an accelerator program to improve the border security clearance. I did a TEDx talk on social media in July, and I was recently the lead organizer of a startup weekend. I've been all around New Zealand and talked to a number of people, from plastic manufacturers to GPS specialists to cartoon license holders, and of course, medical professionals. I'd love to add insurers and generally anyone in this room to that list. Now, everything that I've said today is all well and good, but why should you care? For the same reason that I have the passion to solve all of these problems. I believe that if we can implement even half the things that I'm proposing, we can significantly improve healthcare. I've already built the hardware prototype that works, and I have a number of exclusive partnerships all lined up. I am ready to change healthcare forever, and I want you to join me. Thank you.